Project AirQual, a resource for creating healthier communities. Air pollution is harmful to human health. Our video series is a tool for creating awareness of this public health concern. The purpose is to explain ways air pollution harms our health, improve understanding of factors that contribute to air pollution in communities, and bring public health into community planning and design decisions. This project is provided by the Community Outreach and Engagement Corps of the Harvard Center for Environmental Health, with funding from the National Institute of Environmental Health Sciences.
Finding the link, air pollution and community wellness. Do you know that the quality of the air where you live can affect how long you live? In 1993, researchers published the results of a 16-year study that tracked health and air pollution in 6 U.S. communities. The 6-city study showed that as air pollution increased, the likelihood of sickness among the populations in these communities also increased.
The original concept of the 6 cities was to find 2 communities with very high pollution, 2 communities with low pollution, and 2 communities with intermediate pollution to get a whole range of exposures across the country. Back in the mid-70s, we had the Arab oil embargo, and there was a lot of increasing use of imported fossil fuels, imported oil for power production.
The research undertaken by Dockery and his colleagues identified the large negative effect of fine particulate matter, which can come from the sulfur of smokestacks.
As the sulfur gets oxidized in the air and forms sulfates, those are fine particles. In fact, on a day like this, where we have these hazy type conditions, this is fine particles in the air, a lot of sulfates, a lot of sulfur particles in the air. This is a characteristic of the type of air pollution that we found to be particularly bad for the populations. The good news is that if you clean up air pollution, then you do see improvements in health.
As people became aware of the dangers of power plant pollution, smokestacks were made cleaner. During the cleanups, Dockery's team continued to follow up with the 6 cities. They found that even after many years of high pollution, cleanups were effective in improving health. Unfortunately, there are many sources of air pollution. Large industrial facilities such as chemical plants, steel mills, refineries, and waste incinerators are called point sources of air pollution. In order to protect human health, we must also control area sources and mobile sources of air pollution. Area and mobile sources seem small individually, but collectively they add up to a lot of pollution. Area sources are small and widespread, so it is difficult to point to them in specific locations. For example, emissions from heating and cooling systems, wood stoves, and wood boilers are considered area sources. Mobile sources of air pollution are those that come from vehicles both on and off the roads.
If we're going to effectively control air pollution and effectively control fine particles, where should we be focusing the effort? Is it universal in all types of particles, or are there specific types of particles and specific sources that need controls?
In what ways are you contributing to air pollution each day? Remember, when we pollute the air around us, our own health is at stake.